Hello there. My name is Dr. CalmingEscape. I'm going to be working with you today on our asthma study. Thank you so much for coming in and for volunteering for this medical study. As you know, we are looking into some research regarding a pill that would help to prevent asthma symptoms within our patients. Perfect. So you filled out a lot of paperwork to be accepted into our medical study, I understand. I do, however, have a couple details I do need to confirm with you today before we do your checkup and further enter you into this study as one of our test subjects, okay? Perfect. So some of this might be a little bit repetitive depending on how recently you filled out that paperwork. But if you have any questions or comments, concerns today, please just let me know. Everything should be fairly straightforward. Okay? Okay. Good. Now, I'm sure you were told, but just so that you are reminded, this is a double-blind study. So basically what that means is each of our test subjects has the possibility to get the real pill that we are testing, the real medication, or you could potentially get the placebo. Double-blind means that I have no idea which one you are getting. You will not know which one you're getting until the end of the study. Because some of our test subjects, obviously we have to have a control group, and that is what the placebo pill is for, okay? Okay, as long as you understand, I don't know which one you're getting, you do not know, it's completely blind, and we will just document it on your chart as we go forward, okay? Good. So, can you please confirm your date of birth for me? And what year is that? And your first and last name? Now, when were you diagnosed with asthma or a lung disease? Okay. And that would make you, let me look at your date of birth. Okay, perfect. Do you have any other medical conditions that we should be made aware of? No. Are you currently taking or have you taken any sort of emergency inhaler and or a daily inhaler to combat your asthma symptoms? Do you know the name of that? Okay, that's pretty common. And how often do you use that daily? Okay. Morning and night. Okay. Any other medications that we should know about? Okay. No. Do you drink any forms of alcohol? And if so, how often? How much? It won't affect your placement here in this test study. We just kind of need to know that to factor it in as a variable. Okay. What about any sort of recreational drugs? Now, with your lung capacity, your lung issues, do you require an oxygen tank at home? Is that something you've ever needed? Okay. All right. Do you have any allergies? Yeah, anything. Food allergies, seasonal allergies, anything that you've been tested for? Okay. Please rate your stress level for me from 1 to 10. And this is just an average stress level in your life. So 1 being no stress at all, and 10 being the worst possible stress. Just on average. Now, same thing, can you rate your anxiety level for me? 1 being no anxiety whatsoever, and 10 being the worst possible. Just on an average week, yes. Okay. Now, how often would you say you experience an asthma attack? Okay. Now, have you had any attacks this week? What about today? Have you had to use your rescue inhaler today? Now, what would you say the main cause of your asthma attacks is? Is it related to allergies, workouts, cold, stress, environment, etc.? A different cause. What would you say for you personally? Because it really varies between subject to subject. Okay. Yeah, it can be multiple too. Okay. And how active are you? Do you go to a gym? Do you work out? Are you on your feet a lot? Do you find that being active can cause an asthma attack for you? Okay, that makes sense. And is there anything specifically that you completely avoid because you know you will get some sort of breathing issue from it? For example, you may avoid smoky areas where there is a lot of secondhand smoke because that could be a asthma trigger for you. Some people avoid pollinated areas where there's a certain type of flower blooming may cause an asthma attack. This can kind of go in with your allergies, but I just kind of want to make note if there is a specific situation or environment that you actively avoid because you know it may cause an asthma attack. Okay. Gotcha. Okay, so I think that is basically all of the questions I had for you today. Do you have any questions for me before I start the exam? Okay, well, this exam is going to become a little bit repetitive as the weeks go by. Every week when you come in, you will be receiving the same exam. We're going to be looking at and testing and listening to the same things so that we can record if there is any sort of change or if there's a positive, a negative, anything like that, okay? Okay, so to start, I'm going to look at your face. Let me just pop on some gloves. Are there any tender or sore areas along your face or neck that I should avoid? Just looking at the symmetry of your face, it doesn't look like there's anything that's swollen, inflamed, irritated. That can also go hand in hand with colder months, allergies, and irritants. Okay, so I'm just going to be touching your face and lightly palpating. Is that okay? Good. gonna go down to your neck, kind of near your lymph nodes. Is any of this tender? I'm gonna look at your eyes now. So I'm gonna be popping on this light. Bear with me. Okay. Yeah, you can just look right forward at me. Now holding your head still, can you just follow the light? Okay. Now can you open up and say, ah, I'm gonna look at your tongue. Yeah. Our tongue can actually say a lot about us health-wise. Good. Maybe a little bit dehydrated. Be sure to kick in and get that water in there every day. I know it's hard sometimes. Okay. Okay. I'm going to be listening to your heart now. And then we're going to move on to the lungs, of course, so I can get an idea of what your lungs sound like. Breathing normal, deep breaths, breathing fast, things of that nature. But for now, let's just listen to your heartbeat real quick. Okay, just relax for me. Your heart sounds nice and normal. Gonna move on to the lungs, so I just need you to relax, breathe normal for me so I can kind of see how your lungs sound in a normal way. I'm gonna be moving the stethoscope around, so just don't mind me. I'm going to reach around you, listen to the side, from the back, and reach around this side, from the back. Okay. Okay, there's like a slight wheezing, but nothing to be concerned about. Now, I need you to take some deep breaths for this next part. Every time I place my stethoscope, I just need you to take a nice deep breath, okay? Okay, ready? Here we go. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay. Now for this, it's a little silly, but I need you to breathe really fast, so... Okay, same thing, just keep up a more fast rhythm, and I'm going to be placing my stethoscope around just to listen to your lungs at a faster pace, okay? Okay, go ahead. Keep going. Yeah, keep going. Good. Good. Okay, you can breathe normal. Okay. Now I'm going to need you to take a breath and hold it while I listen to your lungs, and I'll let you know when you can breathe again, okay? Here we go. Deep breath. And out. Again, deep breath. And out. Deep breath. And out. On the back, deep breath. And out. Again, deep breath. And out. This side, deep breath. And out. One more right here, deep breath. And out. Good. Good. Okay. So next up, the last little bit that I need from you is kind of a breath strength test. If you've had any sort of asthma testing before, you may have seen something like this. Some medical offices still use this, some places don't, so it's kind of different for each person, but it's really straightforward. So here we're going to have you breathing into this little asthma check here. Okay, and it's going to give us kind of a strength level for your normal breath, okay? And as I said, we're going to be doing this each time you come in for your weekly appointment, so we kind of monitor if your lungs are getting stronger, if your asthma breath is getting a little stronger, so we can monitor that, okay? Reset it for you. Okay. So here you see you're going to be putting your lips around here and blowing into this, and this little red lever is going to go up, and that's going to reveal your breath strength, okay? Some people use this during asthma attacks to see which type of medication they should be taking. For today, we're just taking it as a baseline of how your normal breath right now, what level it ranks at. Okay? Okay, so here we go. Okay. Take a deep breath and then just blow out. Okay. Okay, just drop that down. We're going to do this 3 times. Okay. Reset it. Again, do a nice deep breath and then blow out. Okay, good. You're at a pretty good level. Definitely weaker lungs, but obviously that's why you're here, so nothing to be ashamed of. But you're not in like a red zone or anything like that, so we're good. Okay, we're gonna do it one final time. Deep breath and blow. Okay, perfect. Okay, let me go ahead and grab those pills for you. Alright, so here are your pills. There are a count of 30 in here. For the first portion of this test will be the 30 days. You take 1 tablet each day. Okay? It's usually preferred after breakfast, something in your stomach, just so it doesn't cause any sort of nausea. Okay, so you can take these with you. We will be seeing you once a week to determine if anything is changing. Remember, as I said, I do not know if this is the test drug or if this is the placebo, but we still really do appreciate you taking part in this test run, this test trial. Okay, do you have any questions for me? So you can go ahead and take those. If you do have any questions, comments, concerns, even before your next appointment, don't hesitate. You can call us, email us. We're available. Okay. So I think that is everything I needed. And looks like you have your weekly appointments already scheduled, correct? Good. So then we will see you next week. Thank you so much for coming in. Yeah, I'll see you next time.
If you are interested in supporting my channel, check out my Patreon page. Starting at just $8 a month, you can get sneak peeks, exclusive photo sets, and more special